All attendees are in listen-only mode.
Hi everybody, thank you so much for joining me today. There are lots of you today and I really appreciate you coming. Just a little bit about me while we wait for everybody else to show up. I have been a owner employee at Blue Poppy for, since the late 70s actually, when we first started the company, and I don't usually do webinars on herbal medicine, but there's been a lot of interest lately in the gynecological formulas, and I thought it would be useful to give people more detail about how to do gynecology using Blue Poppy Originals, since there's been just recent questions and interest about these formulas. So I hope you find some useful information. And let's begin. Let's hope everybody who wanted to get here has arrived. So just a little bit about gynecological statistics in the United States. There's an awful lot of gynecology practice in Chinese medicine, and there's a good reason for that. First, virtually every single woman in the United States and all over the world actually is affected by a gynecological condition or infection or problem or disease at some point in her life. For example, up to 30% of menstruating women have mild to moderate PMS, and up to 10% of them have really severe PMS. That's an awful lot of women right there. Like, I don't know what that comes to, 15 million? It's a lot. Just if you treated PMS, there's plenty of patients out there. Secondly, women seek health care twice as often as men do. Now, most of us know this. Our practices are heavier with women than they are with men in most cases. So it's the main piece of our market in any case. Women have a longer life expectancy, up to 10 years depending upon race, over men, so they need care longer. And here's an interesting statistic for you. 14%, or 150 billion annually, of all health care costs for women are paid out of pocket, which probably includes us. So that's good to know that women are willing to seek health care and they're willing to pay for it. So unless you are in a sports acupuncture practice where you may have more 50-50, your practice is going to be 60% or better women in any case. Another good reason to consider gynecology if you're not already practicing it is that Chinese medical gynecology is hugely effective for so many different things, and it works so much better than Western medicine for so many different things. We have a fabulous track record with all of the various symptoms of PMS, endometriosis, pelvic inflammatory disease, all types of bleeding disorders, many types of infertility, which those of you who are doing infertility practice know that the Western medical community is quite aware of how good Chinese medicine is for helping women who seek out assisted reproductive technology, how good it is to use Chinese medicine to help them get pregnant. Certainly all kinds of menopausal symptoms can be greatly ameliorated by Chinese medicine, and we can also treat all kinds of post-gynecological surgery symptoms. So if you choose this specialty, or if you already have, you could be helping thousands of women during your clinical life. Herbs versus acupuncture in gynecology. So while acupuncture has become very popular, and there's a number of books that have come out in recent years about using acupuncture for gynecology, and there's certainly nothing wrong with doing it. In China, if you choose gynecology as a specialty, your practice will be herbal medicine. That is what you will learn. In China, acupuncture is used for certain things, specifically dysmenorrhea or any kind of pain perimenstrually, nausea during pregnancy, and sometimes as an adjunctive therapy for other issues. But in China, gynecology is an herbal specialty, hence that's why I'm talking about herbs today. So, Blue Poppy Originals for gynecological conditions. Where did these come from and how did they start? Well, when Bob Flaws started his practice back in 78, 79, he quickly saw that mostly what was coming to him, or a lot of what was coming to him, were gynecological cases, and he very quickly decided that he would specialize in it, that it was going to be easier to be really, really good at a smaller universe of conditions. So these formulas that became the Blue Poppy Originals in the gynecology section of formulas were formulas that he used successfully year upon year, and he would tweak them this way and that, but he came down to, here's what's working for the majority of women that I treat. And so these were the formulas that eventually became Blue Poppy Originals once we decided to create a line of formulas. So first let's talk about added flavors, supplement the center, and boost the qi. Of course, this is based on Li Dongyuan's famous formula Buzhongyi Qi Tang, with added ingredients from a formula called Arshan Tang, or Two Immortals decoction, and then some stop bleeding medicinals, because that's what this formula is about in general. The patterns that you can use this formula to treat successfully are spleen qi plus kidney yang vacuity or deficiency. The liver will be depressed, in other words, liver depression, qi stagnation, which has hung out long enough to create heat. And this heat will probably have entered the blood phase. Now, we know that if you study gynecology, you know that there are only 4 reasons for pathological bleeding. Either the spleen is not strong enough to hold the qi in its vessels and passageways, or there is blood stasis pushing the blood outside of its channels, or there is heat causing it to sort of bubble up and over the top of its normal pathways and channels. And then the 4th one is traumatic injury. Now, while you could have trauma, certainly, from a gynecological surgery, the first 3, qi deficiency, heat, and blood stasis, are going to be the ones that are the most common, that you'll see all the time in women who have some kind of pathological bleeding going on gynecologically. So, what indications would we use this for? Luteal phase defect, and we'll come back to that in just a minute. Pathological uterine bleeding, early menstruation, or menstruation that goes on and on and on and on, and the bleeding is excessive. Repeated miscarriages. And so why a luteal phase defect is listed first is that it could be responsible for pathological uterine bleeding, early menstruation, or the periods coming too close together, being flooding and overflowing, or repeated miscarriages. So what do we see here in the formula itself? And I have some of these medicinals highlighted. Chaihu and Shengma upbear the clear yang energy where it's supposed to go, to the heart, to the sense organs, to the lungs, and it disinhibits the qi mechanism so that what is going up should go up and what is going down should go down. We know that Jiao and Imu Zao are stop bleeding medicinals, and Aya stops bleeding specifically by warming the uterus. Of course, that's our moxa herb. And Huangqin clears heat, but it also, it clears heat specifically in the liver, stomach, and lungs. But if you read further down in the list of what Huangqin can do, it also is a stop bleeding medicinal. Most of us don't remember that about it. We just think of it in terms of clearing heat, but it's way more than that. So Shenmao and Shenling Pi are medicinals that are known to have a pronounced empirical effect on regulating hormonal function in general and on the ovaries in particular. So they are excellent medicinals when you need to treat a luteal phase defect. And I don't remember why I had Baiju highlighted. But anyway, so the kinds of women that you'll be seeing here are menopausal women with either excessive bleeding or too frequent bleeding or both. So in other words, bung lo, which is the Chinese disease of flooding and leaking, or hua tai, the disease of slippery fetus is how that's translated actually. It's the same hua as hua mai, slippery pulse. Or jingxing xianqi or jingxing guoduo, too close or too much. And common enough, if you're treating women, you're going to see women with pathological bleeding on a fairly regular basis, and this is an important formula to have, even if you're making it yourself. You know, you don't have to buy our formulas. If you have a granular pharmacy, you could make this formula, no problem. Next, change and enrich, which is the first here alphabetically of our 3 menopausal symptomology formulas. This formula is a combination of Danzhi Xiaosan, Ganmai Dazao Tong, and Suanzao Rentong. Now, Ganmai Dazao Tong and Suanzao Rentong are old Jingui Yalue formulas back from the same time as the Shahan Lun. Danzhi Xiaosan is a much more modern formula. And this formula will treat the very common combination of a heart-spleen dual vacuity or deficiency, a liver-blood kidney yin deficiency, but this person will have marked liver qi. This person will be irritable. This person will have sighing and frustration and possible variable amounts of pathological heat going along with that liver qi, but their liver qi situation will be worse than some other women might who are perimenopausal. So menopausal night sweats, insomnia, possible irritability, and quite probably irritability or depression or anxiety or some kinds of psycho-emotional symptomology to go along with it. And what's in this formula? We see, of course, Fushen, which calms the spirit, and Suanzao Ren for sleep, and Shengdi and Shanju Yu to supplement the kidneys and enrich yin and nourish liver blood, Ye Jiao Tong to nourish the heart, Fu Xiao Mai to stop sweating. Wu Wei also can be used that way. Lu Ti Cao is an interesting medicinal. Herba pyrroli. It's a wind-treating medicinal, but it is used, in this case, to rectify the qi, as so many wind-treating medicinals are. And it also has the interesting impact of strengthening the low back by supplementing the kidneys, and it is empirically used to stop heart palpitations, so it can have a number of positive impacts on menopausal women. Or something else in here. Then you'll also see a bunch of qi rectifiers, Jerdza and Tuanchong and Chaihu, Baiju, there's Shengma in here? No, there's not. In any case, to rectify the qi mechanism so the person doesn't have so much liver qi. And then a nod to moving the blood with Mudan Pi and Xuanchong, and also a little bit with Dangui. So this is a very interesting formula to use. Danzhi Xiaosan, of course, coursing the liver, resolving depression, clearing heat. Your clearing heat from the blood plus Xiaosan formula. I think those are the most important things to say about the ingredients in that formula. But the rationale here, which I think is important to note, and most of us, or is often forgotten, that the severity and duration of menopausal symptoms in our cultures, in any case, can't say for sure about ancient Chinese culture, but in our culture, those symptoms are proportional not so much to how much yin shu or yin deficiency there is, but to the severity of the liver qi, because it's the qi mechanism that is required to function properly for any large or small metabolic change in the body to go smoothly. So if the liver qi is not smooth and free-flowing, and therefore the qi mechanism of what goes up and what goes down and what goes out and what goes in, if that can't happen smoothly, then the change of life, so to speak, is going to be very difficult for it to be normal. So this formula supports all the yin organs and viscera, but more importantly, it strongly rectifies the qi, much more so than most other menopausal formulas. So if you have patients like that, it can be helpful, and it can be combined with other formulas depending on patterns, and you can check out the section on combinations on our website. Okay, Moon Harmony. Moon Harmony is a early Qing dynasty, so 1700s, formula from Gongding Shen, one of Bob's favorite pre-modern doctors. And this formula is for all sorts of breast lumps, swelling, pain, etc., as well as the emotional irritability that can go along with that. The only time you cannot use it, you can see at the bottom here, is if you suspect that there are heat toxins, i.e. breast cancer, that has yet to be ruled out. But the interesting thing about this formula is that not only does it treat the possible qi and blood deficiency, possibly some small amount of yang deficiency, plus qi stagnation and blood stasis that you would expect to see, but it treats upward counterflow that affects the chongmai, the dumai, and the taiyang, as well as, of course, it has medicinals for phlegm nodulation. But so what is this about the chongmai, dumai, taiyang? What this has to do with is that the heart and chongmai are the most yin parts of the body in a certain way. They do not have an affinity for heat. Now you might say, oh, wait a minute, the heart is a fire phase organ. But don't get too hung up about 5 elements here. When the heart fire should not manifest as heat, it should manifest as light, it should manifest as wisdom, it should manifest as intelligence, it should manifest as the sparkling eyes of a healthy Shen, not as heat. So if there's heat in the heart or the chongmai, it will exteriorize it through the dumai and the taiyang, which is why people with this kind of, with breast lumps will often have a tight neck, they may have bruxism, they may have a tight jaw, they will have symptoms that are also affecting the taiyang and dumai as well. When you do palpation on this, you'll find sore spots. And those of you who've heard any of my early webinars have heard me talk about that breast treatment, acupuncture treatment for clearing heat this way out of the heart, the chongmai, the dumai, and the taiyang. In any way, so the rationale here comes from Gongding Shen's statement, in young women with breast disease, blame the liver, and in older women, blame the chongmai. And Bob has also written an interesting article about this if you want to try to find Bob Flaw's article about breast disease and the dumai and taiyang, which I believe is on our website. So this is a good formula for women whose main premenstrual symptom is breast pain, lumps, and swelling. Phoenix Rising. This is another Li Dongyuan formula from his book, The Landramitsang, Orchid Chamber's Secret Treasury, which he called Upbear Yang and Lift the Menses. His original formula had Shishin in it, but we substituted Baijur because Shishin has some aristolochic acid in it. So we use Baijur because this formula can be used for premenstrual headaches, and Baijur is a good medicinal for treating headaches in any case, so maybe it's even a better substitution. The patterns here will be a liver-spleen disharmony, so the liver is stagnant and the spleen is weak, plus blood stasis and blood vacuity, which often go together, we know. Some small element of yang vacuity may be there as well. But what's happening here is because the spleen is weak, the defensive qi is not strong enough, and so the person has wind, cold, invasion, which manifests as B, or stagnation and wind, cold, evils obstructing the normal flow of the qi in the joints and in the surface of the body. So this formula will treat a wide range of symptoms and indications, but they will mostly have to do with pre- or perimenstrual body pain, or premenstrual headaches, or B conditions in older women, possibly dysmenorrhea in menstruating women. But notably, this formula is excellent for older female patients with osteoarthritis or rheumatoid arthritis, which can manifest because of this defensive qi weakness, allowing qi, wind, cold, damp evils to enter the body. What else to say about this? You notice the rogue way. We mentioned there might be some yang vacuity, and what rogue way does is it helps the any heat in the body attach itself to or re-enter its lower source in the lower jiao. So rogue way is a wonderful sort of mild, warming medicinal that can be used to help healthy Mingmen fire. Baizhi is in there for the headaches. Shudi to supplement the kidneys. Baishao for supplementing the blood. Honghua, Chuanchang to move the blood. Duhuo for pain in the joints, knees, low back. Chuanchang for body pain, Fangfeng, Baizhi to move the qi, Dangui to supplement and move the blood, Taoren to move the blood, Fuzi to warm the channels. So this is an interesting formula, noting that it is women in their 40s with spleen qi and kidney yang insufficiency who are the ones that typically will get the beginnings of rheumatoid arthritis or osteoarthritis. And women get these with far more prevalence than men. Let's see now what's next. Ah, yes, supplement yin. Again, from the great Dr. Gongding Shen from the 1700s. This formula is for the long-term treatment of postmenopausal women to prevent disease like arthritis and also the weakening of women's bones post-menopausally. This formula has good research behind it to show that it can prevent the bones from getting weak. And there is no limit to the amount of time that this formula could be taken by someone. It doesn't have any toxins in it, unlike formulas that have Shenmao and Shenling-Pi, which do have some toxins. And so this could be taken for years. It will make the bones denser and help prevent osteoarthritis or any kind of bone density related condition. Okay. It is for kidney yin and yang insufficiency with deficiency heat. You'll see that it has Zhimu and Huangbai in it for deficiency heat. It also supplements, it also moves the blood and treats your very common adult liver spleen disharmony. So when women start to get, when their bones start to weaken, they can get back pain, which is an early symptom of the bones starting to disintegrate. You can have weakening of the bones in the spine will present as back pain. There may also be fatigue if the spleen is weak or the spleen and the kidneys are weak. Insomnia, hot flashes, night sweats, your common menopausal fare, and possible clinical depression, so liver spleen disharmony plus blood stasis causing the qi not to move very well. So we see here that we have Shu Di and Sheng Di for strengthening liver, blood, kidney yin, Fu Ling for removing dampness and supplementing the spleen, Zhimu Huang Bai to clear deficiency heat, Dang Shen, another spleen supplementing medicinal, Dang Gui and Bai Shao to nourish the blood, Nyoshi, Buguzhi, and Duzhong to strengthen the bones, and Xiaohui Shang and Chunpi to make all of this, to help the Shu Di and Sheng Di not be cloying and difficult to digest. So this will not harm the spleen, and it is an excellent and important formula for treating postmenopausal women to help keep their bones strong and to prevent arthritis and bone loss. Ultimate Immortals is the last formula we're going to cover this afternoon, and this formula is one of our best sellers. It is a combination of Arshen Tong, 2 Immortals decoction, Arjur Wan, 2 Ultimates pills, and Ganmai Dazao Tong, which is a common stop sweating and supplement the heart kind of formula. It is only for the remedial treatment of perimenopausal symptoms, and it should not be taken for a long time, and we'll come back to that in a minute. It is a very common combination of patterns that this treats. You will see this in real women all the time. A liver, blood, kidney, yin deficiency, with also the yang being somewhat depleted as well. There may be ascendant liver yang hyperactivity, which manifests itself as vacuity or deficiency heat, heart, blood, spleen, qi vacuity, and there will be liver qi. There'll be liver depression as well in this woman, although not as much as in change and enrich. So here we have Fu Xiao Mai to astringe the surface, Mu Li and Long Gu to are heavy settling medicinals to push down rising qi and heat. The He Huan Pi and Ye Jiao Tong quiet the spirit and nourish the heart, as well as the Nujunza to some extent. The Hanlian Sao and Nujunza are yin supplements, but are not cloying like the Shu Di and Sheng Di can be, so they are easier to digest. Da Zhao for the heart, Fu Ling for the spleen and heart, Zhimu Huang Bai to clear heat, and then the Shen Mao and Shen Ling Pi, which again have this ovarian hormonal regulating function and are strong medicinals in this formula for quickly pushing a woman through stopping those symptoms. But especially the Shen Mao has some toxins in it, and the Chinese say it should not be taken for a long time. 3 months, okay, maybe 6 months maximum. But according to the Materia Medica, these are not to be taken for a long period of time. So the symptoms for Ultimate Immortals will be anxiety, fatigue, possible emotional depression, night sweats, hot flashes, those usual suspects, heart palpitations, and insomnia. Common enough set of symptoms for menopausal women. But again, if you have a woman who's on this for 3-4 months, you need to start maybe switching her over to something else, either Zhibai Di Huang Wan or something like Supplement Yin in our line, are more appropriate for long-term care. And if the woman has any history in her family of osteoporosis or bone loss, then wise to take a look at the supplement Yin formula, since it has some major random clinical trials about osteoporosis on it. Certainly any of our other Blue Poppy formulas, original or classical, can be used with women patients. It's not to say that these are the only formulas you could use with women. Some of the other conditions that our Blue Poppy originals treat are more frequently seen in women, especially migraines, for example, and we have our formula Celestial Mansion for that, and the Anti-Nui Boost the Chi formula for chronic fatigue and immune deficiency syndrome, people who have the afternoon flushing and heat in the 5 hearts, afternoon fevers. That formula is very effective for that. But because those are not specifically gynecological formulas, I did not include them in today's presentation. So if you have questions about any of these formulas or any Blue Poppy formulas, don't hesitate to call us. We're happy to discuss any of our products with you if you have a question. And there's our 800 number if anybody needs us or would like to call. I think that's it. If you have any questions at all from me, you can send me an email at Honora, H-O-N-O-R-A, @bluepoppy.com, and I would be happy to hear from you. Thanks so much for taking your time to spend with me, and thanks for being a Blue Poppy customer.